Well, first of all, New Hampshire is thrilled to have been named as one of the top 10 SafeRx awardees, especially being in slot number 5 and the progress that we've made over the last year from the prior report. Things that have really, I think, helped to accelerate the state have been not only just the federal HIT incentives, but an incredible amount of work that's taken place at the ground level with the provider community as not only providers have been able to put more resources into deployment of e-prescribing, but also the vendor solutions that are providing these tools. The workflows have improved and increased in terms of their efficiency and effectiveness, and have really led to higher levels of provider adoption. I think that the primary challenges for the state, at least in the early years, had to do really with the deployment of resources. When the project initially was started, there were very few provider organizations that had enough bandwidth within their IT departments to move forward rapidly. They were also highly constrained at the time by many of the vendor solutions, which did not necessarily have the most efficient or effective workflows to really encourage provider adoption. But over time, we've seen both an increase in resources within the provider organizations, as well as improvements in the workflow capacities of the vendors that are providing the solutions, which I think is greatly added to the overall adoption rates within the state. And then clearly the impact of the high-tech incentives has also been felt and has been a key driver in the last few years in really pushing New Hampshire up into the top 10. Clinical interoperability is absolutely critical for New Hampshire in terms of helping us to achieve a high-performing healthcare system. We see electronic prescribing not only as the on-ramp to health information technology, but also ultimately to full-blown health information exchange. While electronic prescribing may be viewed initially as a very discrete form of health information technology interoperability, it can have enormous benefits in terms of things such as polypharmacy, and reducing adverse drug events in specific populations, such as those over the age of 65. We think that in an ongoing basis, electronic prescribing, along with health information exchange, will absolutely improve the overall healthcare quality and delivery within the state of New Hampshire. So the ultimate goal for New Hampshire in terms of e-prescribing is to make sure that every single physician and every single pharmacy is up and running and live with the technology so that we can ensure for the patients in the state of New Hampshire that they can have the highest quality of care, they can have an excellent consumer experience and customer experience, and that we can be sure that we're using technology as appropriate to not only reduce administrative costs, but to improve the overall quality of the care delivery system within the state of New Hampshire. New Hampshire is absolutely thrilled to be part of the SafeRx Awards and especially to be within the top 10 this year. It's been a journey for us over the last 5 years, beginning with efforts from the New Hampshire Citizens Health Initiative and our Governor, John Lynch, who helped kick off the efforts. But none of this would have been possible without the assistance of a great many other players from our provider community to our payer community, as well as employers who were also supportive along the way. We just want to thank the folks at Surescripts for this recognition. It's a great honor for the state of New Hampshire, and to thank everybody in the state who's been involved in the effort over the last 5 years. We're just most appreciative. So thank you very much. We appreciate it.